Hi everyone, this is lecture 35, where we're covering numerous topics such as fertilization, embryology, parturition, and lactation. So, in this lecture, we'll describe the steps that are required in order for fertilization to occur, how the fertilized egg is implanted into the uterus. We'll describe the early embryonic development, the development of primary germ layers. We'll discuss the embryonic membranes that form, the function and the formation of the placenta and the umbilicus. And then we'll look at changes that we will see in a growing fetus and the subsequent embryo. And then we'll look at the hormones secreted during pregnancy. And finally, we'll finish off with labor and just a small amount about lactation. So this is one of the longer lectures of the semester. And so let's get started. So let's begin with the processes that involved in fertilization, embryology, parturition, and lactation. So first, let's look at an overview of the human development. We're going to make some general definitions so we're all on the same page. Okay. Fertilization begins with the union of gametes. Remember, we have a haploid sperm, haploid egg that come together to form a zygote. The discipline, developmental biology, studies the changes from fertilized egg to the old age. The discipline, embryology, studies the 38 weeks of development in the womb. So the human gestation period is 38 weeks. We can also describe prenatal and postnatal periods. The prenatal period is a time in the womb, and the postnatal period refers to the period following birth. Okay, let's take a look at prenatal development. Prenatal development goes from conception to birth. Okay. And so prenatal development, the offspring or conceptus develops during the gestational period. And generally the 38 weeks is divided into 3 stages: the pre-embryonic, embryonic, and fetal stages. Okay, so we have the pre-embryonic, embryonic, and fetal periods. And we will see that the embryonic period is weeks 1 to 2, the embryonic period is weeks 3 to 8, and the fetal period is weeks 9 to 38 until birth. Okay. We're going to come back to these a little bit later. But first, we're going to go through the different parts of life of a person, and then we're going to come back to this prenatal period. The postnatal period is the rapid developmental changes in the first few months. And it's divided into 5 stages. We have a neonatal period, infancy, childhood, adolescence, and adulthood. The neonatal period lasts about from birth to 1 month, infancy from 1 month to 2 years, and childhood 2 years to puberty. Adolescence is puberty to sexual maturity, and adulthood is sexual maturity to the time you die. So this is the stages of life. We also have what's called senescence. Senescence is when development ends and body starts degenerating of the tissues and organs, and of course this will lead to death. Okay, so let's look at the pre-embryonic period now, a little more closely. Remember, it occurs from fertilization through implantation and occurs during weeks 1 and 2. So here's the pre-embryonic period. Okay, it's going to be characterized by a blastocyst, for example. And what happens is after fertilization, the zygote divides mitotically many times to produce a multicellular blastocyst that implants into the uterus. Okay. So it begins with fertilization of the secondary oocyte. And now the blastocyst moves to the uterus and implants an endometrium. And we're going to eventually talk about the extraembryonic membranes that form, that's going to help support the embryo. Fertilization will occur. It's the fusion of sperm and secondary oocyte forming a zygote. The zygote is the fertilized egg. Now, prior to fertilization to occur, 3 different events has to occur to successfully be fertilized. These are capacitation, acrosomal reaction, and the cortical reactions. All three of these need to be completed. So let's say capacitation first. Here, the sperm becomes fully motile and fuses with the oocyte. Up to this point, the sperm generally did not really swim too much. It's conserving its energy until it gets close to the oocyte. Remember, the semen is alkaline to help neutralize acids in the fluids, and it also allows them to swim faster. As we see in this figure, the sperm will be is going to be attracted by progesterone secreted from the oocyte. That's going to chemically attract it, or this process is called chemotaxis. Okay, and so these changes will occur on the sperm plasma membrane. Now, the second important event that must occur before fertilization is the acrosomal reaction. Now, if you recall, in the head of the sperm has an organelle called the acrosome. It's very similar to a lysosome that you learned in SCB 203. The lysosome is inside the cell, and it will digest things that it brings into the lysosome. The acrosome is slightly different because it releases its enzymes externally. Two of these enzymes are hyaluronidase and acrosin, and these will digest the cells surrounding the egg, the secondary oocyte, because these granulosa cells are surrounding it, and the sperm, in order to fertilize it, has to get through. So usually what occurs is many sperm undergo the acrosomal reaction to help digest the pathway for one lucky sperm to fertilize the egg. Okay. Sperm bind the receptors in the zona pellucida to open up calcium channels, and these calcium channels then release these enzymes to digest holes in the zona pellucida. Okay. As we said, the sperm work as a teamwork to release enough enzymes for a single sperm to fertilize the egg. So here we have sperm releasing their enzymes and burying their heads into the zona pellucida. The last event that must occur before fertilization occurs is the cortical reaction. What happens is when the lucky sperm penetrates the zona pellucida and into the egg, it produces changes in the oocyte, and the zona pellucida prevents additional sperm from entering. So sperm entry releases cortical granules containing digestive enzymes that destroy the sperm binding receptors. As a result, the other sperm are repelled, so only one sperm can fertilize the egg. This prevents polyspermy, in which multiple sperm will fertilize the egg. What you want is to end with a diploid state. A triploid state is not what you want, and that'll be detrimental, and the zygote will die. So the cortical reaction will reject the sperm and prevent polyspermy, which will be fatal to the zygote. Okay, finally we get fertilization, where the sperm nucleus swells, forming the male pronucleus, and the nucleus is released into the cytoplasm of the oocyte. So that's the only thing that the sperm contributes, is this nucleus. Mitochondria stays outside. So all future mitochondria from the offspring are derived from the maternal mitochondria. And now we remember what happens once fertilization occurs is that the oocyte finally completes meiosis II, as it was stuck in metaphase II, and forms the female pronucleus to fuse with the male pronucleus. What happens? Spindle forms between them, and the chromosomes intermix to give us the diploid state. Now, after fertilization occurs, the first steps is to have several mitotic divisions, which we call cleavage, to form the blastocyst. Okay, so the pronuclei intermix through empty mixes to form the diploid zygote. and then start dividing mitotically, which we call cleavage. So the zygote begins cleavage 30 hours after fertilization, and these produce identical cells called blastomeres. By the second day, 4 cells, and the end of the third day, 16 cells. So here, third day, 4 cells, and by the third day, 8 cells, and then forms a 16 cell to be 16 cell stage, which is now called a morula. A morula means little raspberry. Okay. So here we are at the 16 cell stage. Now, in the process of these cleavage divisions, the zygote is moving along the uterine tubes toward the uterus to eventually implant into the endometrial lining. So here we see the migration of the zygote, and here we are before entering just once entering the uterus, it's at the morula stage. There, glycogen-rich secretions, which remember we call uterine milk, from the endometrial glands will help nourish conceptus. What happens is the blastocyst hatches from the zona pellucida, and the blastomeres form internal fluid-filled cavity. Okay, so we could see here the blastocyst forming with this internal cavity here. And it will prepare for implantation in days 4 through 7. The outer layer, the trophoblast, surrounds the fluid-filled cavity to help form the placenta, and the inner cluster, the inner cell mass, becomes the embryo. So here we can see here the inner cell mass will become the embryo, and the trophoblast cells will eventually form part of the placenta. And here you can see it's starting to start the implant in the uterus. Now, during the first 8 days, some cells may separate into 2 individuals, forming monozygotic or identical twins. So this is due to a cell that splits. A more common type of twinning occurs when 2 secondary oocytes ovulate at the same time, producing a dizygotic or fraternal twins. So the zygote fraternal twins, you can have a boy and a girl. But in monozygotic twins, you can only have 2 girls or 2 boys, since they're identical. Now, days 4 through 7, the blastocyst attaches to an endometrium of the uterus to begin implantation. What happens is the trophoblast invades the stratum functionalis by secreting digestive enzymes degrading the endometrial lining. By doing so, it will start burying itself into the endometrial lining. Okay, and then once it covers itself, we say that implantation is completed. Okay, so day 4 through 7, the blastocyst attaches to the stratum functionalis, and the trophoblast differentiates into 2 regions: the syncytial trophoblast and the cytotrophoblast. Okay, the syncytial trophoblasts have their plasma membranes disappear, producing a single multinucleated cell, whereas the cytotrophoblast, the membranes remain the same. Now, why does it do this? Well, the syncytial trophoblast secretes enzyme digesting uterine cells so that it can start burying into the endometrium for implantation. The inner cell mass differentiates into 2 regions, the hypoblast and the epiblast, forming what's called the embryonic disc. Okay. And then from the epiblast, we're going to start seeing a cavity form that will lead to what's called the amniotic cavity. Okay, so we see here the hypoblast closer to the trophoblast, and then we see the epiblast, in which the syncytial trophoblast is starting to bury in. By day 12, the syncytial trophoblast invades the uterine lining, and so what happens is the maternal blood vessels become digested and forming pools of blood called lacuna, or intervillous spaces. And by doing so, the syncytial trophoblast reaches the nutrients in the uterine glands. And it also begins producing human chorionic gonadotropin. Okay. That will stimulate the corpus luteum to secrete estrogen and progesterone to maintain the pregnancy. And remember, HCG is what's detected in pregnancy tests. Okay, so here's day 12. And you can see the amniotic cavity being formed here. By day 16, the blastocyst moves deeper and becomes covered by the maternal epithelial cells. When this occurs, the blastocyst has been fully implanted. So here, it's been completely covered now, so now it's been completely implanted by day 16. Now, normally it implants in the uterine lining. However, there are occasions when something terrible happens in which the blastocyst implants elsewhere. And these are what are called ectopic pregnancies. And this occurs like 1 to 2% at a time. But these are usually going to be fatal and will not survive. Now, what develops are what are called extraembryonic membranes. And these membranes will assist with the vital functions of the embryo, as well as some may persist as future organs of the fetus. Okay? And they usually appear in the second week of development and continuing embryogenesis in the fetal periods. So some of these extraembryonic membranes are included here. For example, the Yolk Sac, the amnion, the Chorion, and Allantois. So these are examples of the extraembryonic membrane that are going to play an important role in survival of the embryo. Now, the Yolk Sac forms from the hypoblast cells, and it forms the part of the digestive tract, the first blood cells, the first blood vessels, and also the first germ cells that will eventually become sperm or ova. Okay. So here showing the Yolk Sac at week 3, that tiny little thing here, and you can see it becomes more like a sac-like by week 4. By week 5, it's completely separate structure here. So that's the Yolk Sac. The amnion develops from the epiblast, enclosing the embryo in fluid-filled amniotic cavity. The amniotic fluid has very important functions because it protects the embryo from trauma. It also maintains temperature, so it doesn't the temperature changes are maintained. It also gives them freedom of movement, so the embryo can move around. And the only penetration is by the umbilical cord. Okay, so here's the amnion in blue here. So this is at 3 weeks. Here it's completely circling the embryo at 4 weeks. In 5 weeks, you can see the fluid is getting larger as the embryo grows as well. So the amniotic membranes completely surrounding the embryo and fluid, the amniotic fluid. Now, when you hear the statement that a woman's water breaks, that's the amniotic membrane breaking, and the water leaking out is the amniotic fluid. And usually this indicates that the initiation of labor. The Allantois is an outpocketing of the Yolk Sac. It forms the base of the umbilical cord and part of the urinary bladder. So many of these extraembryonic membranes have important embryonic functions, but many are retained for future organs later in life. So here's the Allantois at 3 weeks of development. Here's at 4 weeks of development, and finally here's at after 4 weeks. Another important structure is the chorion. Okay, and this develops from both the cytotrophoblast and the centrotrophoblast, and it closes all the other membranes of the embryo. So the chorion is the most outer layer surrounding the embryo, and it forms chorionic villi that blends with the stratum functionalis that's going to form the placenta. Okay, so here's the chorion with chorionic villi extending outward. Okay, that's at 3 weeks. At 4 weeks, it's a little more invasive. Here's the chorion surrounding the entire structures of the embryo. And here's at week, here's at the late in week 4. So the chorion will also grow as the embryo grows. So finally, here's a summary of the 4 extraembryonic membranes, describing their function. These are the yolk sac, the amnion and amniotic cavity, the allantois, and the chorion. Now let's look at embryonic period weeks 3 through 8. We're in the next stage, the embryonic period. Of course, this occurs after implantation. We've done that already. We have differentiation of embryonic disc. Okay, we've done that. And development of extraembryonic membranes, and we described that. So the embryonic period, weeks 3 through 8, begins with a process called gastrulation. And gastrulation occurs when there's a rearrangement and migration of the embryonic disc that begins as bilaminar, 2 layers, to form a trilaminar or 3 layers embryonic disc. And these 3 layers are called germ layers because they will come with all the organ systems by week 8. Okay. The placenta forms and begins to provide nutrition and oxygen to the embryo and removes waste. Okay. So up to now, the corpus luteum has been serving that function. So let's look at gastrulation and the formation of the germ layers. The 3 germ layers are endoderm, mesoderm, and ectoderm. Okay. So let's look at week 3. The primitive streak forms a groove on the surface of the epiblast. Okay, and this will distinguish the head and tail regions, and also the right and left sides and dorsal ventral surface of the embryo. So now it's going to start having, the embryo is starting to have more form to it and shape. Once the primitive streak develops, then gastrulation begins. Okay, so here's the primitive streak here, and as it modifies, it'll definitely start forming a head and a tail end, right and left and sides. Okay, and here's up close of the embryonic disc. We see there's 2 layers. Okay, the epiblast and the hypoblast. And what gastrulation occurs is the movement of these cells of the epiblast as they enter the primitive streak and migrate inside it, forming a 3 layers, a trilaminar set of membranes. Oops. Okay. So you can see that the cells that migrate in the center, here in red, will become mesoderm. Okay. The outer layer here forms the ectoderm, the blue part. Okay. And so here are them all together. And of course the bottom layer is the endoderm, in yellow. Now, by late in week 4, the trilaminar disc folds to become more cylindrical. Before it was kind of flat, but now it's starting to take a little more shape, so it's rounder. Okay, you can see in week 3, week 4, and late week 4, rather than kind of a flattened hot dog here. It gets more shape and being rounder. Once we have the 3 germ layers, the ectoderm, mesoderm, and endoderm, we can begin what's called organogenesis, in which we start differentiating into the organs and organ systems. Okay, so for each of these 3 germ layers, we know what each will be destined. So for example, the ectoderm forms the epidermis, the nervous system, and the sense organs. Okay. So how does the ectoderm differentiate? Well, it does so by neurulation, which is the formation of the brain and spinal cord. Okay. The neural tube develops, and the primary brain vesicles, the forebrain, the midbrain, and the hindbrain begin to form. And specialized cells called neural crest cells produce the ganglia, nerves, pigmented cells, and the adrenal medulla. Okay. So these three steps are involved in the differentiation of the ectoderm. Now, mesoderm forms the nodal cord, okay, somites, ribs, the dermis, and skeletal muscles. Okay. Now, you might not have heard of the nodal cord before. The nodal cord supports the body and remains as intervertebral disc in the future body. Okay. Of course, there's some primitive vertebrates that retain the nodal cord. Most vertebrates, the nodal cord will develop into another structure, such as here, the intervertebral disc. In the mesoderm, we have what are called somites, that have three regions that will produce the sclerotome, that becomes the vertebrae and rib, the dermatome, which becomes the dermis, and the myotome are most of the skeletal muscles. So both the epidermis and dermis are formed by different germ cell layers. The epidermis was the ectoderm, and the mesoderm produced the dermis. Okay, here are some other structures produced by the mesoderm. The gonads, or reproductive organs, kidneys, the spleen, the adrenal cortex, the cardiovascular system, serous membranes, and also connective tissue of the limbs are developed from mesoderm. Lastly, we have what's called endoderm, that last yellow layer, which produces a variety of organs. Okay, so for example, it produces the epithelium of the digestive, respiratory, and urinary and reproductive system. It makes the middle ear cavity and auditory tube is from endoderm. The thyroid, parathyroid, thymus, and palatine tonsils are all derived from endoderm. Liver, gallbladder, and pancreas also is derived from endoderm. Many diverse organs are the result of endoderm. Okay, so here's a summary slide that indicates all the structures produced by the ectoderm, mesoderm, endoderm, the three germ layers. Okay, so let's look at a summary of organogenesis. Okay, by week 4, we have the rudimentary organs present. Okay, so here's week 4 of MRI. You see the somites down here. Okay, here's by week 8. One question is, why does the exposure to teratogens during organogenesis increase the risk of birth defects? Okay, well, teratogens cross the placenta and harm the embryo, and during organogenesis, the developing tissues and organs are not susceptible to these agents due to rapid growth and development. Okay, so they're most susceptible, especially because they're mitotically dividing at a high rate. Now, a few years ago, what was in the news was a Zika virus, and so it is very dangerous development, if you remember. Okay, remember the disease is spread to people primarily through the infected Aedes mosquito, and infection during pregnancy can cause serious birth defects called microcephaly, where you have a small head, and the ability to target these neuronal stem cells. Now, the last stage of the embryonic period is the fetal period. That's week 9 to week 38 until birth. Okay. So in the pre-embryonic period, the embryo receives nutrients through uterine milk and digested endometrial cells. However, during this time, the placenta is being formed by week 12. And then this process of producing the placenta is called placentation. The placenta is a temporary organ for exchange of oxygen, nutrients, and waste between the mother and fetus through the umbilical cord. So that'll be the line for the rest of the gestation period. So we can see the umbilical cord, okay, and the surrounding placenta. So the umbilical cord connects the placenta to the fetus. And remember, there are 2 umbilical arteries and 1 umbilical vein. And remember, these umbilical vessels are opposite in terms of oxygenation as you would think. They're like the pulmonary vessels, where the pulmonary umbilical vein carries oxygenated blood, and the umbilical arteries carry deoxygenated blood. Okay, so here's the umbilical arteries in blue, here's the umbilical veins in red, and they collectively make the umbilical cord. Remember, now if you recall, the chorionic villi penetrate the uterine blood vessels to form blood-filled lacuna. And as the lacuna merge as a single cavity, produces what's called the placental sinus. At placentation, the sac stratum functionalis becomes the decidua basalis. Okay, so here's the decidua basalis, and here's the maternal blood in the placental sinus. The placenta develops from both fetal and maternal structures. Okay. And if you recall, the fetal blood and maternal blood makes the placental barrier formed by the maternal and fetal basal lamina, fetal connective tissue, the cytotrophoblast, and also the cystotrophoblast. Okay. So here's the placental barrier. Because you don't want blood entering to affect the cells, because remember, these cells are unique individual cells compared to other cells of the body. Okay, so remember, the placenta functions to allow gas, nutrients, and waste to pass by diffusion. So it is lifeline to the fetus. So one question is, how does the fetal hemoglobin become saturated with blood? If you at the umbilical arteries become very close contact with the umbilical vessels, you would expect only, in theory, 50% of oxygen to bind. But actually, the fetal blood cells are saturated. Now, why is this? Well, because the fetal blood has a unique type of fetal hemoglobin, which will increase the binding of oxygen to hemoglobin. And this fetal hemoglobin is called hemoglobin F, or gamma hemoglobin, and it has a higher affinity to oxygen than adult hemoglobin. So it can rip off the oxygen from the mother's blood cells so that it can bind stronger on the fetal hemoglobin. Now, the placenta is a very important structure, and it also produces human chorionic gonadotropin. It produces estrogen and progesterone, so it's also an endocrine organ. It produces human placental lactogen and placental prolactin to prepare the mammary glands. And it also produces relaxant to relax the body during delivery. Now, we'll take a look at the major events of fetal development. Okay, at month 3, the crown to rump length is about 9 centimeters. This is when, by week 3, the bones start to ossify. Eyes are well developed, and the sex can be determined at this point. By week 4, the crown to rump length is 14 centimeters. Startle reflexes develop, and the kidneys are well formed. And you can be able to hear the heartbeat using a stethoscope. By month 5, growth is slowing, starting to have hair on its head. It's covered by the hair-like lanugo, brown fat forms, and it has a crown to rump length of about 19 centimeters. By month 6, there's a significant weight gain. So the crown to rump length is about 23 centimeters. The eyebrows and eyelashes form, eyelids open, and lungs start begin producing surfactant. By month 7, the fetus turns upside down. The subcutaneous fat is deposited. For male, the intestine will descend at this moment to outside the pelvic cavity. and the crown to rump length is now 28 centimeters. By months 8 and 9, neuronal networks form, organs are growing, and the node goes shed, blood cells form in the bone marrow, and the crown to rump length is about 36 centimeters. So it's still pretty tiny. So here's the big picture of prenatal development. Okay. So this incorporates everything we've talked about so far. We have the fertilization, the pre-embryonic period, the embryonic period, and the fetal period. Now, during pregnancy and childbirth, there are numerous changes occurring in the mother during the pregnancy. So the pregnancy is divided into 3 trimesters, each lasting about 3 months. Okay, so the first trimester is about 1 to 3 months, and it's very critical and more spontaneous as more spontaneous abortions occur. And during this time, the mother may experience morning sickness and fatigue. The second trimester is months 4 to 6, and the uterus and abdomen begin to expand, and some individuals feel that it's giving relief to morning sickness, and at this point the fetal movements can be felt. Lastly, we have the third trimester, months 7 to 9. The uterus and abdomen enlarge further, and generally the back aches and pressure, and there's pressure on the internal organs. Okay. Now let's take a look at the hormonal changes that occur during this time. The syncytial trophoblast secretes human chorionic gonadotropin to maintain the corpus luteum and to secrete estrogen and progesterone. FSH and LH are inhibited by the anterior pituitary, stopping the normal ovarian cycle. Human chorionic gonadotropin declines after about the 4th month, as the corpus luteum is not needed anymore because the placenta starts secreting its own estrogen and progesterone. A hormone called relaxin from the placenta, this will suppress uterine contractions. It also loosens the pubic symphysis and sacroiliac joints as navel nears. Another hormone is called the human placental lactogen. This will help stimulate breast development and prepares the mammary glands to secrete milk. Okay. At week 12, increases in cortisol from the adrenal cortex occur, and this is what's going to help stimulate the maturation of the fetal lungs and production of surfactant. The surfactant you've probably heard in SCB 203. So the anterior pituitary stimulates milk production from mammary glands. Oxytocin from fetal maternal hypothalamus peaks during labor to stimulate uterine contractions. So let's look at some of the anatomical and physiological changes that occur in pregnancy, to the mother at least. So before pregnancy, the uterus is the size of a fist, very tiny. Okay, but by 4 months, the uterus fills the pelvic cavity. Uterus begins to push into the abdominal cavity and enlarge it from hypertrophy that myometrium, placental, and increase amniotic fluid. By month 7, the uterus reaches the umbilicus. The abdominal organs are displaced upward, compressing the diaphragm and pressing on the urinary bladder. Now, as you might expect, the changes in the center of gravity will occur, and may, of course, lordosis, curvature of the spine, and backaches to occur. The breast enlarged due to increased glandular and adipose tissue. Final step is childbirth or parturition, and this is usually the last step of the pregnancy. And so the fetus is normally expelled through the uterus or vagina, and these series of events is called what's called labor. So we see here that fetal cortex produces cortisol, which stimulates the placenta to secrete a high level estrogen. The high estrogen level stimulates the urethra to form oxytocin receptors, the uterus, form oxytocin receptors. And both the fetal hypothalamus and maternal hypothalamus secretes oxytocin, which stimulates the placenta to secrete prostaglandins. The prostaglandins dilate the cervix, and along with oxytocin, increase the strength of the uterine contractions. A positive feedback occurs, a mechanism where the cervical stretching triggers the release of more oxytocin and prostaglandins. So this will help move the baby as towards the childbirth. Now, labor, the sequence of events in which childbirth occurs, it's in 3 stages called dilation, expulsion, and placental are the names of the 3 stages. Okay, so here's the maternal position of the fully developed fetus before labor begins. Okay, so notice that they're head first, for example. Other things that occur at the onset of labor is the dilation stage, that until the cervix is fully dilated at 10 centimeters. The onset of stage of labor varies 8 to 24 hours, but the amnion may rupture and release the amniotic fluid. Okay? And the head of the fetus enters the pelvis. So after birth, the mammary glands secrete what's called colostrum, which is rich in protein and IgA, but low in fat. Then true breast milk will follow the colostrum a few days later. And the breast milk acts as a laxative to cleanse the meconial fecal material first exerted by the newborn. Okay, what you don't want is this to occur while it's still in the womb. Prolactin is no longer inhibited by estrogen and progesterone from placenta. As a result, the infant suckling the maternal hypothalamus produces oxytocin, and the maternal anterior pituitary releases prolactin. Oxytocin stimulates the myoepithelial cells of the breast to contract, to let down reflex, and also stimulates the mammary glands to produce additional milk. A positive feedback mechanism is responsible for the continued production of milk, which occurs as long as the infant continues to suckle. So the stimulation will provide the milk for the next feeding.